Hi, in this episode of Psychiatry in 5 Minutes, we're going to go over CBT, or cognitive behavior therapy. CBT has exploded in usefulness over the last several decades, and by the way, CBT is always the test question answer if you have a multiple choice question. So cognitive behavior therapy is the idea that the way you think can affect the way you feel. So negative thoughts can make you feel negatively or lead to depression or anxiety. Typically, the negative thoughts occur usually one in a triad, it's called. Negative thoughts about yourself, negative thoughts about the world, or negative thoughts about the future. Negative thoughts about yourself are the most common. That is, I can't do this, I'll never be able to do this, no wonder I can't do this, I'm a failure, etc., etc., etc. What you should do is keep your ear out when you're talking to a patient for these kinds of statements. Negative views of the world is no one will help me, nobody's ever there for me, things like that. And again, that's seen more often in people with personality disorder who blame others rather than themselves. In major depression or in depressive illness, usually there's negative views of yourself. Also, negative views of the future can occur. That is, no matter what I do, things never work out, or things like that. So keep your ear out for that. So what you do in the first session or two is keep your ear out for these negative thoughts. That is, things that people say again and again and again. And point out to them, geez, it seems like you say a lot of times, I can't, or I'll never be able to, or other people don't help me, whatever it is, and point that out to them. The idea is that these negative thoughts lead to negative feelings, but people aren't aware of that. That is, it's become a habit. And so how do you break this habit? You have them work at it, paper and pencil homework. What you do the following week is you say, I want you to write down the date and time every time you say or think this negative thought. I can't do this. For example, okay, August 1, 10 p.m., I can't do this. And you have them do that however many times a day it takes. What you'll find out, whenever you keep track of any behavior, it will decrease in frequency, which is helpful. So you have them do that for a week or two till they get the idea that, boy, this is really happening a lot. And you go over their homework with them in the session. Next thing, what you do is say, okay, write down the date and time, what the negative thought was, but also what was your feeling when this occurred. Okay, so August 5th, 10 p.m., I can't do this. I felt sad or I felt angry. And so what they will eventually learn at the end of that week is that the negative feeling is associated with the negative thought. And do that for a week or two. Then after that, say, okay, what was the situation that brought this up? I mean, it didn't come out of the blue. Something must have caused it. So again, date, time, what was the negative thought, what was your feeling, and what was the situation that caused it? Okay, August 16th, 10 p.m., I can't do this. I felt sad. I took the pre-test for the shelf exam and didn't do well. I can't do this. Okay, you do that for a week or two. In the session, go over what it was. Again, they recognize that it's linked to behavior, that the feelings and thoughts are connected, but so are events in their life. So what you do next, date, time, negative thought, what is it? How did you feel? What was the situation? And what's the truth here? So again, August 30, 10 p.m., negative thought, I can't do this, I felt sad, I was taking the shelf exam, I didn't do well. What's the truth? The truth is, it's just a practice test. I'm doing it to try to learn. Of course I don't know everything. That's the point of taking it. So you don't sugarcoat it, but you try to go over what the truth is, and you go over that with the patient in the session. So CBT is a process where negative thoughts lead to negative feelings. You ask, is it true? Make it true. And over practice with homework, they have to do the daily homework or it won't work. With practice and homework, they can eventually learn skills which will stick with them and be helpful. That's CBT, but read a lot more about it. Thank you.